Hello, this is Dr. Nagaraj Kikeri, again from North Texas Team Care Surgery Center. This is March 22nd, 2020. We are in the midst of, at the beginning stages of COVID-19. So our rules and regulations and our casualties and our new infected patients are changing by the day. What it means is that the statistics that you get in the morning are no longer accurate for the afternoon. And our country and our nation and our society and our people are going through a lot. We have at our surgery center and pain clinic, Advanced Pain Solutions and North Texas Team Care Surgery Center, we have quite a few staff members who work with us. When they work with us, we are dealing with a real issue of how we protect our patients. How is that we protect our staff members? How is that we as a group come together to take care of each other, to take care of our patients, to take care of our society? And that's the message that I would like to convey to you during this second video. So far, we have taken a lot of precautions to protect our patients. That is our number one goal. During this time, when we have this, we have instituted telemedicine in our pain clinic, and we are able to take care of majority of our patients over the phone so that they don't come in. And when they come in with severe pain, we have an obligation to take care of them, because if we don't take care of them, they will end up either suffering or going to the emergency room. And this time and this day and age right now, when a national crisis is going on, going to emergency room is not a very good idea. So what are we doing? We are telling the patients, we are pre-screening them before they come. If they had any fever, if they had any contact with anybody who has fever, or anybody in their social group or in the family who are infected with coronavirus. All these things, after we do a telephone triage and they are allowed to come to the office, and we are not, unless they absolutely need, we are not letting them come inside with an attendant or with their family members, 2 or 3 of them at a time. Not even one family member is allowed to come if the patient is safe to come, walk and sit. In our waiting area, we have designated, we have numbered the seats, we have tagged the seats. They have to sit only in those chairs. Why? Because we are practicing social distancing. We are taking their temperature before they come in, and we are asking them to use the hand sanitizers before they enter the building. And once when they are called in to the examination room, they are also asked similar question to make sure, doubly sure, that we are not exposing other patients and staff members to potential infection. And once when they are diagnosed and treated appropriately, and they are sent out of the office fairly quickly in an expeditious manner. In fact, we are doing a lot of rescheduling either for a surgery or for an injection over the phone, so that we don't keep them longer than we are supposed to. And also, in addition to that, we are following the guidelines of what CDC and the local authorities are giving us, so that we are practicing safe, effective, yet caring medicine. And on top of that, a big part of it is that how do we take care of our staff members? Our nurses our doctors, our front desk, our billing staff, our support staff, they're all in it together. We are trying to limit the number of people coming into the office. For example, people who can work from home, such as billing persons, somebody who can do the scheduling, somebody who can do the insurance verification, and so on and so forth. We are asking them to work remotely. And we are also asking voluntarily for those who don't need to work, and if they want to cut their hours to less than 5 days a week, and this is a voluntary option, and some of our staff members are taking that. And while they are working, we are maintaining a social distance between each employee, and the same rules go to our employees too. If they have any signs and symptoms of fever, or if any of the family members have any fever, or if they have been exposed to anybody who may have COVID-19 or coronavirus exposure, we are asking them not to come to work. They have to self-isolate themselves for the required amount of time before they could come in to work. And more importantly, after practicing all these things, there is a human component that is super important, is that how are we taking care of our employees? And I must tell you that I have phenomenally wonderful staff members. They have decided voluntarily to come up with a game plan so that we can take care of ourselves. A lot of our staff members have come to me and told me that they will forego their pay for the next 3 months. This includes doctors and marketing staff and some of the support staff. And I was very touched by their generosity. And actually, it brought tears to my eyes. I have taken their permission to put this on the video so that the rest of the people should know who they are. And actually, Mr. and Mrs. Karen Duncan and Terry Duncan, they have come out and told me that they will work without salary for 3 months. And Mr. Kishan Kikeri, and he is in the marketing department. He has offered to be furloughed himself but continue to work. Mr. Vijay Philip, this is a young man who helps us with our social media marketing and also the internet website marketing. And he said, Dr. Kikeri, go ahead and furlough me, but I will continue to work. Along the same line, Dr. Shada told me that I know it is important that we handle this crisis and go through this crisis as a team. Don't pay me anything till the crisis is over. And my wife, Dr. Neeraja Kikeri, and myself, we have decided not to take any salary and forego our salary till we take care of our staff members. In addition to that, our other staff members, Miss Sandhya Phillip, she's a nurse practitioner. Miss Nancy Laverne, she's a nurse practitioner. Mr. Trent McPherson, he is a physician assistant. And Dr. Manjunath, they have all decided to take a pay cut so that we can take care of the people who desperately need income during this time. This really fills my heart. This really fills it brings me tears to know that in a difficult time like this, we are in it together to help the ones who need the help the most. In addition to that, I also know Mr. and Mrs. Duncan, they shop for the elderly people who cannot go out in their neighborhood. And we as a team are grateful to have them in our group. Not only that, we as North Texas Team Care Surgery Center and also Advanced Pain Solution, we have established a charity so that any employee or anybody who is going hungry is welcome to reach Dr. Neeraja Kikeri, so that they will never go hungry. Their children won't go hungry. This was the idea that was started, and it was the idea that was rallied by my wife, Dr. Neeraja Kikeri. Folks, we must remember, we are strong, we are resilient, and we will overcome this. We have daily meetings about 10 or 15 times a day. We are going through this minute by minute, hour by hour, day by day to come up with the best way to handle this. And I'm very, very, very confident that we will overcome this. Kindly stay strong, stay positive. If you see anybody doing anything good, come out and praise them. And this is a time to unite. This is a time to take care of each other. Thank you very much for listening. And if you have any helpful suggestions, if you have any phrases or any quotes that you can tell to inspire people, please do let me know. Once again, this is Dr. Nagaraj Kikeri from North Texas Team Care Surgery Center.